Hello, hi, I'm Dr. Kong Min Han. I'm a consultant ENT head and neck surgeon. Vertigo is a sensation of spinning whereby the patient will perceive the environment that's moving or they themselves feel themselves dizzy. There are many types of vertigo, but we usually divide into peripheral vertigo or a central vertigo. The most common is peripheral vertigo, which is commonly like BPVV or benign proximal positional vertigo, Meniere's, vestibular neuritis, or labyrinthitis. The most common vertigo is BPVV. In BPV, patient will present with dizziness. They will describe the room spinning, or they themselves feel spinning, sometimes with nausea, vomiting, and usually it's due to some positional change, such as when they are lying down and getting up, or when they are turning their head to the side or looking downwards. How frequent is BPV? In Malaysia, we do not have actual data of the prevalence of BPVV, but in a study in a university, they found that the walk-in patient to the clinic account for about 30% as BPVV. So the treatment for vertigo, the first thing is to break rest, because during that time they will feel very vertiginous or very dizzy. So some of the medication can help, such as antihistamine or beta-histine, or even some labyrinthine sedation. Other option of treatment is also on the vestibular rehab maneuver, and one of the maneuvers well known is the Apley maneuvers. The other treatment, surgery, is usually not indicated in BPVB. So some of the patients who are not treated for BPV, they can get persistent vertigo, and sometimes the persistent vertigo might actually become a persistent paroxysmal positional dizziness, or we know as PPPD. And these are the group of patients that should be given medication and a vestibular rehab. Apart from it, if it's not treated properly, they will be affecting their work, their lifestyle, their normal activity, and some of them to the extent they are worried to drive car. So for those who sometimes are scared to drive, or sometimes it's not treated, when during driving they might actually develop an acute attack and they might actually involve in accident. So if any patient who develop a vertigo, my advice is to quickly seek treatment as soon as they are able to get out from the house when they do not feel so dizzy. They can either see their doctor, the nearest clinic, or they can come to the hospital depending on wherever they can access to. It's best to, if they feel very dizzy, get someone to help, because sometimes they are trying to move around own self or drive themselves. It might be more dangerous. Some elderly patients, we have high blood pressure, diabetes, or any other medical condition. It is better to seek treatment, because sometimes it is not because of BPV. It can be a sign of they actually have a stroke. So it's best that elderly with other medical conditions, please seek treatment in the nearest clinic or hospital.